Welcome to Physiomobility's Total Knee Replacement Exercise Program for Week 3. For the warm-up section, please repeat each movement 5 times before proceeding to the exercise section. For the first movement, take a deep breath as you reach your arms up towards the ceiling. If you can't reach all the way overhead, reach as high as you can go. You want to reach while taking a deep breath and opening up the chest as much as you can. For this next movement, we're repeating the same exercise in a standing position where we squeeze the glutes, press the heels firmly down into the floor, and relax. When you squeeze, you want to hold for a few seconds and then relax the glutes. Now we're moving on to the exercise portion of this program. For this first movement, make sure that the towel is gripped firmly behind the thigh so that you have absolute control over the movement as it bends and flexes towards the body and away from it. For this movement, make sure that the therapy ball is placed directly under your heels. As you drag the ball towards your body, bend your knees in towards your chest, and use the ball as you push back outwards. Take your time with this movement and make sure it is nice and controlled. For this next exercise, make sure that the operated leg is as straight as possible. In this position, you're going to lift up towards the ceiling, just under knee height, and back down. You want this movement to be nice and slow and controlled, keeping the leg as straight as possible with toes pointed up towards the ceiling. For this next movement, have your operated leg placed at 90 degrees against the wall. From here, you're going to bend it down into a flex position and slide your foot back up the wall. Use the wall as a guide to slide your foot down and back up. Lying face down, starting with the non-operated leg in a bent position and the operated leg straight, you want to bend the knee, driving your heel towards your glutes, nice and controlled, and then relax back down straight. As we've done previously, for the sit to stand exercise, you're going to push through your heels to stand up nice and tall and sit back on the heels nice and gently to sit back down. Unlike before, try it and not use your hands to stand up as much as possible. If you have to, refer back to using your hand. Seated on the edge of your chair, try and push your knee forward to touch the wall and relax back to a seated position. For this one, you really want to make sure to try and bend your knee as much as possible while keeping your heels down on the ground. Please make sure that you are positioned close towards the edge of the chair, sitting up nice and tall as you push the hips back to lean forward with a straight back. Make sure that the operated leg that we are working on is as straight as possible and toes pointed up towards the ceiling to ensure maximum stretch during this position. It's important not to hunch forward. In a seated position, with the towel placed underneath your knee, try and extend your lower leg as straight as possible, toes up pointed towards the ceiling, and nice and controlled back down. You want to use your thigh muscles to squeeze your legs straight and relax. Standing upright, using the back of the chair to help with balance, you want to push your weight back onto your heels, pushing the hips back into a half squat, and stand back up nice and tall. Make sure that you're using your hips first, and then the knees will bend gradually. Placing your operating leg forward in a straight position, push the hips back as much as you can to feel a stretch behind the hamstring. You also want to keep your foot in a flex position to get the maximum stretch behind the knee. So that you feel the stretch behind the hamstring as much as possible, make sure that your back remains completely straight in an upright position. For this next exercise, place your operated leg onto a step and slightly bend the knee forward so you get some greater knee flexion. You want to take your time through this movement, gradually place your foot on top, and bend as much as you can. For this next movement, place a stool behind you to place your operated leg's foot on. From there, you're going to rock your ankle forward while also pushing the knee down and forward just slightly so that you can feel a stretch in the front of your thigh, also known as your quadriceps. You're going to repeat this motion back and forth until you feel a sufficient amount of stretch. For this next stretch, Place the chair beside you to make sure that your body can get into a lunge position. Your non-operated leg will bend forward as keeping your back leg as straight as possible. From here, you want to make sure that you're tucking your hips under and pushing that operated leg's hip forward. In a standing position, keep your operated leg as straight as possible and use your glutes to lift off to the side, bringing the foot off the floor and back in together at midline. Similar to the previous exercise, keep your operated leg as straight as possible and gently lift to the back, using your glutes and using your heel to direct the movement. After you've completed 10 repetitions of each exercise, make sure to go through this routine one more time and talk to your therapist if any new problem develops.